morning and welcome to Our Issues Milwaukee. I'm your host, Andrea Williams. Our focus this morning is on the AIDS Resource Center of Wisconsin. They are one of the largest and fastest growing AIDS service organizations in the country and nationally renowned, known for their excellence in HIV healthcare. My first guest is the president and CEO of the AIDS Resource Center, Michael Gifford. How are you?
I'm well. Good morning. Thanks for having us.
Thank you for being here, and you've been here before.
I'm glad to be back.
So I should say welcome back. Thank you. And the AIDS Resource Center of Wisconsin, it's one of the most unique HIV healthcare centers in the country. As I mentioned, you offer a plethora of programs and services to individuals on a daily basis. So let's start off talking about some of those services.
Sure. ARCW's created what's known as the HIV Medical Home, and that's integrated health and social services that really take care of all the needs of our patients and clients. So it's not just the medical care, the health care, medical, dental care that they need, or the mental health or drug treatment services they need, but we're also working to overcome the social determinants of health. We know a lot of our patients struggle with poverty, so we're providing them financial assistance. They struggle with homelessness, so a lot of housing assistance. They struggle with hunger, so we have actually one of the largest food pantries in the city of Milwaukee.
Wow. So those are all very important things. And what's most important when you talk about just the overall health of people living in our community, you are a place where they can go to be tested for HIV, remain anonymous, and then also be tested for other STIs, right?
Right. Certainly, ARCW is taking a holistic approach to both the needs of the patient, but then also the demands of the epidemic. So people who come in and test for HIV can also be tested for STIs. They can be tested for hepatitis C, which is a often common co-occurring condition. And then again, for that patient, it's meeting their healthcare needs and whatever the barriers are to them and their families getting access to care.
Yeah. So in your opinion, why is it so important to have these integrated services for people who are living with HIV?
You know, it's so important to have these integrated services because it's all the isms and phobias of our world that are really fueling the epidemic, whether it's racism or sexism, transphobia, homophobia. These are, unfortunately, the people that we're serving oftentimes are pushed to the edge of society. And what we're trying to do is bring them into care and support them successfully in care by making sure they have the basic needs met, like food and a safe and decent place to live, and then also access to really the finest health care that's available anywhere in the country for people with HIV.
Yeah, and when we kind of take a look back, I think it's safe to say that we've come a long way, and we probably still have a ways to go as far as the masses really having an understanding and a compassion for everything that goes along with the whole scenario of HIV/AIDS. When you look at the 80s and you fast forward to now, wouldn't you say a lot of progress has been made?
I think we've made a lot of progress, especially on the scientific or the treatment front.
Yeah.
I mean, the treatments available now are outstanding. People with HIV who can afford them, who can get access to them, who can adhere to them throughout their lives have a chance to live almost a normal lifespan.
That's amazing.
Unfortunately, a couple of places where we haven't made the progress that we would like to certainly is on PrEP, the new medication that can prevent the spread of HIV that I know we're going to talk about later, but then also on stigma. I mean, we continue to hear this from our patients and clients that they face stigma and discrimination based on their HIV status. And one of the services we offer is legal representation for our patients and clients. And far too often we're having cases where patients are going in to get health care elsewhere and they're denied access to health care because of their HIV status. Had a patient in northwest Wisconsin who was denied access to a homeless shelter this winter because of his HIV status. So while we've made great progress on treatment, and people with HIV and AIDS can really look forward to a long and healthy life if they get access to care, stigma is one of those things that we need to make a lot more progress on.
Wow, and that's why it's important for us to have these conversations, because I'm sure to some people watching, it's hard to believe that in 2019, people are still saying, oh, you can't be served here or you can't stay here because of that, because it has been taught and awareness has been spread over and over again, the many ways that people cannot contract this situation.
Yeah, it is really challenging to think 4 decades into the epidemic that we still are facing these issues of stigma. And unfortunately, what it means is people at risk maybe don't want to get tested because they don't want to get labeled as HIV. Or if you're living with HIV, I may not want to go into care because I don't want to be identified. Or I don't want to access PrEP because I don't want to be identified as somebody who may be at risk for HIV. So that stigma isn't just something that's out there. It's got a really negative impact on being able to reach the populations that need our services.
Yeah, makes sense. And the work that you do really has allowed people in Wisconsin to live longer than any other state in the country. That's something to be proud of. And how are you able to claim such an awesome thing?
We certainly are proud of it, and we're thankful to all of our supporters, public and private, that make that possible. But the federal government issues a healthcare report card for each state every year, and it shows that Wisconsin has the lowest mortality rate in the country, which means people living with HIV live longer here than anywhere else.
Wow.
And that's what's gotten the attention of AIDS organizations all over the country, and that's what's really fueling our expansion into new areas like Denver and into St. Louis. And in total, there's organizations from 26 states that have come to Wisconsin to learn how we are achieving that, learn about this integrated model of care, and we're really being asked to deploy the model of care now in many, many other communities around the country.
So almost become a blueprint.
A little bit of a blueprint.
Yeah.
So we know Wisconsin's good at exporting things like beer and cheese and motorcycles. We're proud that we're exporting HIV services now too.
Yeah, so let's talk about the latest outlook. When you're talking about treatment and research, obviously you've mentioned that things are really looking good when it comes to people living longer, healthier lives, but you've got 90% of your patients who have an undetectable viral load. Explain that.
So having an undetectable viral load simply means that your HIV is managed as best as possible. Still HIV positive, but you're as healthy as possible. That's good for the patient because HIV isn't diminishing your health within your own body. The other research, it shows that people who have an undetectable viral load aren't able to transmit HIV to others. So there's also a prevention component to that. So it's good both for the patient and for the broader community in our efforts to reduce and someday end the AIDS epidemic.
Now, in doing my research, I came across these statistics, and I'm like, this blew me away. So you mentioned you, of course, conduct testing for both HIV and STIs, and I'm well aware this is an uncomfortable subject for a lot of people to talk about or even hear about, but statistics show that roughly half of all sexually active people in our city will get an STD by the age of 25. That's startling.
Yeah, it is startling.
Yeah.
And as the father of 3 teenage daughters, that hits home in a real significant way for me. But it is also indicative of we've made great progress in the fight against AIDS, but that progress is all at risk because it's the same behaviors that lead to STIs and STDs that lead to HIV. And we all know the opioid epidemic sadly continues to consume our community.
Yeah.
So we need to be fighting these epidemics, STIs and opioid and HIV, in a coordinated way. Really excited that the new health commissioner is doing a good job for the city of Milwaukee on that. And ARCW is proud to be involved in all 3 of those epidemics. The most important thing with that stat is parents have got to be talking to their kids and schools have got to be educating kids, and both need to do more.
I couldn't agree with you more. And so when we talk about those type of statistics, what do you say to those people who constantly walk around with the mindset that, oh, that can't happen to me?
Yeah. Well, I mean, the statistic says it itself, right? 1 out of every 2, right?
Yeah.
So for a kid who's sitting in a 9th grade or 10th grade classroom at high school in a couple of weeks when school starts, they can look around and say, half of us are going to get an STI in the next couple of years. Why not me, and what steps do I need to take as a high schooler to protect myself?
It's all very important. And as we wrap up this segment, I definitely wanted to remind the viewers about the dental clinic and the pharmacy that you have there at the AIDS Resource Center of Wisconsin. And I wanted to kind of highlight and pinpoint those because all of these things that you offer are under one roof.
Yeah, they're all under one roof. They're all provided by an integrated team of professionals from each one of those disciplines. And it's that integrated model that's really creating the great clinical outcomes. You know, what's so great about it is It's unfettered access to care, so we'll provide care to everybody regardless of ability to pay. The quality outcomes, viral load suppression that we talked about earlier, are leading the country, and it's being done at a cost savings to the healthcare system to the tune of about $12 million a year.
Wow.
This is a model that really needs to be considered and replicated for patients that are dealing with other chronic diseases beyond HIV and AIDS.
Okay, well, thank you for all the great information up to this point. You did mention the prescription drug PrEP.
Yeah.
So we're going to take a break and come back and talk more about that. All right?
Wonderful.
Yes, Michael Gifford is the president and CEO of the AIDS Resource Center of Wisconsin. If you'd like more information about anything that we've discussed up to this point, you can visit their website at arcw.org. And when we return to Our Issues Milwaukee, we'll continue our conversation with Mike and be joined by Tiffany Wynn, who serves as the Director of Marketing and Public Relations of the AIDS Resource Center. We'll discuss their Prepped Up campaign and more right after this.